As the COVID-19 virus spreads around the world, the World Health Organization has acknowledged that the crisis is generating increased levels of stress and anxiety as people try to navigate mounting uncertainty about the pandemic. The Black Dog Institute is finding people are less anxious about contracting the virus and more so about the personal and financial impact on their own lives. To discuss some of the measures to combat this, clinical psychologist with the Black Dog Institute, Associate Professor Jill Newby, joins us now, very appropriately via Skype, practising social distancing as we speak. Jill, thank you so much for your time.
Thanks for having me. It's good to be here.
This is, of course, a time of huge uncertainty, so it's no surprise that people are feeling anxious. What are they most anxious about, are you finding?
We're finding there are very individual differences in what people are feeling anxious about. Some people are worried about contracting the virus themselves, but more often people are worried about their families getting sick, especially vulnerable or the elderly people getting sick. But then more so, many people are worried about their finances, about the future and what the future looks like, but also about self-isolation. They're really worried about how they're going to cope with being in isolation.
I'll ask you for a few tips on coping with that in a moment, but I wanted to ask you about, I know that you say that a small level of anxiety is actually helpful. In what way?
Some anxiety can be helpful. Not all anxiety is bad, and I think we need to keep that in mind. Past studies from past pandemics have actually shown that when people are a little bit anxious, they tend to do the things that help stop the spread of the disease, like hand washing and self-isolation when it's needed.
What are some of the things then that people can do to manage their anxiety?
There's so many different things that people can do to manage their anxiety. The first point is recognising it and knowing when you're feeling anxious. The second thing is use the strategies that have helped you in the past. So if there's things that you do normally that help you get through stressful or anxious times, use those strategies. So take care of your body, make sure you're getting enough sleep, exercising regularly, keeping check of your diet, also making sure you're channeling the anxiety into action. So when we feel anxious, we tend to worry about the worst case scenarios, but instead what we need to do is actually get informed about the virus and what things we can do to keep ourselves safe and keep other people safe, and also make a plan with our families about what we're going to do if we are stuck in self-isolation. And then there's other things that can be done to keep your anxious thoughts in check, and also to limit media and other things that might be fueling the anxiety. Sometimes when we're bombarded with information or conversations about coronavirus, it can be very anxiety provoking, but we're often not aware of that. So limiting your conversations, limiting your exposure to media can be really helpful to combat that.
Except for conversations like this, which of course are very important. We are being encouraged to self-isolate, of course, and stay at home as much as possible. That might be wrapped up further in the weeks to come. But that doesn't mean we have to cut off from people altogether. I think people forget that, don't they? What are the ways around this, of staying connected while we're still stuck at home?
Yeah, that's right. And I think that's part of the messaging. You self-isolate, but that's more physical isolation. We don't want to isolate from friends, because when people are in quarantine and at home, it can be a time that does feel really isolated and can make people feel down and more anxious. So the things that we would suggest doing is just taking use of our great technology to get in contact and connect with friends. So it can be as simple as a virtual coffee or a virtual wine with friends. It could be organising a meeting with your colleagues over Skype or a Google Hangout, or it could be a simple phone call to check in with other people, and also to make sure you're socially connected during this time.
And if people are really struggling with their mental health at the moment and they need to speak to a professional, what can they do? Are there ways of doing this remotely without having to actually go out?
Yes, so the great thing the federal government has done is introduce some new Medicare items that enable people in self-isolation and some vulnerable groups, including those over 70 and with chronic health conditions, to access psychology sessions via telehealth, which means you don't have to go into the clinic to see a psychologist or a psychiatrist. You can actually do that via video conferencing facilities or via phone. For those people that don't fall into those groups, then there's other options. So Australia has some great online programs that have been going on for 10 years or so, that are very easily accessible, either free or a low cost, and can be done now. So some of the examples we recommend are the Black Dog Institute's My Compass program. That's a free self-help program to manage stress, anxiety and low mood. This Way Up has a range of different online programs that can help teach how to manage stress, teach skills like mindfulness to help manage your mental health, and also target clinical conditions like depression and anxiety if the anxiety or low mood has gotten out of hand. And then there's MindSpot Clinic, which provides online programs with telephone support from a psychologist remotely. So they're all great options if you're not feeling like you're coping.
Yeah, we'll just repeat those. It's Black Dog Institute, My Compass, This Way Up, and the other one you mentioned was MindSpot Clinic, all there for remote counselling and ways to deal with anxiety. And we should remember, it helps to keep in mind that this will all one day come to an end, Jill.
That's right. The more we can do now to stop the spread of the disease, the sooner things will get back to normal. But also it's really important to keep in mind that anxiety doesn't always last. So we've found in past pandemics that people's anxiety is quite high during the height of the spread of the virus, but it does actually go away and eases in time. Most people are resilient and they get through it really well using the coping skills that they have.
Oh, some wonderful advice there. Thank you so much for joining us via Skype and keeping us feeling connected, Jill.
Thanks for having me.